Hi everyone, it's Melina. Today my presentation is going to be about the cardiovascular perfusionist career field. I decided to choose this career for my presentation because I find the job very interesting and very suitable for me and my type of personality in the working environment that I want when I have a career. But I also wanted to learn more about it because the job itself is not very well known, and I wanted to learn more about it for myself to possibly consider it as a career, and I wanted to share the information with everyone else in case somebody else was possibly interested in this career field and wants to learn more about it. So what exactly is a cardiovascular perfusionist? A cardiovascular perfusionist, or perfusionist for short, is someone that has full training and knowledge of extracorporeal technology that is key for allowing open heart surgeries to take place. These extracorporeal machines artificially pump and oxygenate the blood while the heart is unable to do so during these surgeries, and it is the perfusionist's job to manage these machines so that the patient is perfusing appropriately. Since the perfusionist is temporarily taking over the role of the heart, it is their responsibility to also control bodily functions such as maintaining appropriate vital signs, body temperature, and the rate of blood flow. So with most perfusionists, they typically work in the operating room, but you can also find them in didactic settings, teaching the next generation of perfusionists the knowledge they need in order to be successful in their careers. You can also find them working alongside manufacturers to research and produce new technology that works even better and more efficiently than what's currently out there. Perfusionists will work with many individuals of the healthcare team, including surgeons, anesthesiologists, physician assistants, nurses, and surgical techs. A working schedule for a perfusionist is a standard 40-hour work week, but the job can require you to work night shifts, weekends, and holidays. In order to be accepted into a perfusionist program, there are some requirements that you must meet in order to do so. Typically, with most programs, you'll find that you'll need a bachelor's degree in a science or health-related field from an accredited university. There are a couple programs I found where you don't need to have a science or health-related degree, but there are some courses that you have to take prior to getting accepted in order to get entrance into the program. Some of these courses can include biology, chemistry, anatomy and physiology 1 and 2, organic chemistry, and biochemistry, just to name a few. Applicants also must maintain a minimum 3.0 cumulative GPA as well as a 3.0 science GPA. Applicants also must maintain a minimum of 3 letters of recommendation, and they also must have shadowing hours with a practicing perfusionist in order to get accepted. Most perfusionist programs are a graduate level program where students will earn a Master's of Science in Cardiovascular Perfusion upon completion of the program. I did find a couple programs where you can have a Bachelor's of Science in Cardiovascular Perfusion upon completion, but in order to get into this type of program, you must meet the minimum credit hours and requirement courses in order to do so. I also found that rather than getting a master's degree, there are some programs that are postgraduate certificate programs where students will receive a certificate rather than a degree upon completion. After researching, I found that programs can often vary in length between 18 to 24 months. Like most healthcare career fields, perfusionist programs will contain classroom-based learning, hands-on simulation training, as well as clinical experience throughout the program. So in order to become a certified perfusionist, The exam that you must take is called the Clinical Certified Perfusion Examination. This exam is broken up into two parts. The first part is called the Perfusion Basic Science Exam. This portion of the test has 220 multiple-choice questions that will test the basic knowledge of the sciences and processes that the machines take over. This allows students to know what's going on with the machine and what they're actually doing, rather than just knowing how to operate the machine itself. The second part of the exam is called the Clinical Applications in Perfusion Examination. And this will consist of 200 to 230 multiple choice questions that go over different real-life scenarios that students can come across in their careers as a perfusionist. So in order to be eligible for the Certified Clinical Perfusion Examination, there are some requirements you must meet in order to be eligible. One of these requirements is completing a minimum of 75 clinical perfusion cases, with at least 10 of them being pediatric patients. These 75 cases must be completed prior to graduation, and they're typically worked into your program curriculum so that students won't have to stress about fitting them into their busy schedule. Students must also complete 40 clinical perfusion cases after graduation with a practicing perfusionist overseeing them. All of these cases must be complete a minimum of 4 weeks prior to their examination date. Due to the perfusionist career field being much smaller than what you would typically find for most jobs, employment opportunities are often much more competitive than most. From 2019 to 2029, there is a projected 12% increase in jobs. This is due to the population growing at an exponential rate, so there needs to be more people to fill these jobs as there's more and more people getting older and needing these open heart operations. On average, the salary for perfusionists is around $124,000 per year. This is a picture of just one type of extracorporeal machine. This is known as a heart-lung machine. And I thought this picture was super interesting because it's a close-up of the entire machine that the perfusionist knows how to operate that pretty much keeps the patient alive during these open heart surgeries and allows the body to receive the proper perfusion that it needs. In the operating room, typically this machine and the perfusionist are kind of off to the side, out of the way of everyone that's operating, and they're usually at the head of the bed because that's where the anesthesiologist or nurse anesthetist sits. And along with the perfusionist, the anesthesia providers play a part in maintaining the vital signs for the patient, so they can both sit and work together at a close range to make sure that the patient is stable. Here's a list of all the references and resources that I used to obtain the information I needed in order to create my presentation. The links are also provided for you in case anyone was more interested in the career and wants to learn more about it. Thank you for watching my presentation.